Hello, beautiful people. Welcome back to the health and wellness section of Empower Life with Cleopatra. Today, we're shining a light on a very common skin condition that can affect your confidence and self esteem: melasma. You may have heard it called the mask of pregnancy, but the truth is, it can affect anyone, whether you're pregnant, male, female, young or old, it can affect anyone. Now, what is melasma? The simple answer is it's a skin condition that causes dark, irregular patches on the skin. Usually it occurs on the cheeks, on the forehead, on your nose, on your upper lip. It can also occur on your neck, on your chest, on your forearm as well. But it happens when the skin makes too much melanin. You know, melanin is the natural pigment that gives our skin, our eyes, our hair their color, right? Okay. So it happens when you have too much of that. Now, what are the triggers and what are the causes of melasma? Well, it happens to be that if you're exposed to too much sun, the ultraviolet rays in the sun can trigger more pigments to grow. Okay. Also, hormonal changes during pregnancy, or if you're going through menopause, or birth control pills can trigger melasma. Genetics also can make you have melasma if it runs in your family. Certain medications or cosmetics can also irritate your skin to cause melasma. In short, if your skin is grown, the sunlight or hormonal changes can just switch it on. Okay. So what do you look out for? Well, melanin shows as a symmetrical brown or gray-brown patch, right? Most of the time, like I said, on the face or maybe on your arm and things like that. But it doesn't itch, it doesn't hurt. But many people can feel very uncomfortable and can be emotionally distressing, really, because it makes you feel some kind of way about your appearance. But the good news, though, the good news is it can be preventable. It can be prevented, right? So if you use a broad spectrum sunscreen every day, maybe SPF 50, that can help. If you wear these wide hats to protect your skin and use your sunglasses, that can also help. But also avoid the sun as much as possible. And also try as much as you can to, if you're using hormonal medications, to use the sunscreen as well. Now, when it comes to treatment, patience is key because melasma will take months sometimes to improve. The doctors will recommend things like topical creams like hydroquinone or retinoids. Chemical pills will gently exfoliate dark patches. Light or laser therapy can help with the stubborn types of melasma as well. But always remember that strict sun protection alongside your treatment will make it go away faster. Now, if you want to go the natural route, for milder cases, some people will use natural things like aloe vera gel because that will soothe the skin. They can use green tea or licorice extract because that would help reduce the pigmentation. Also, turmeric masks will have some mild lightening effect as well. But remember, please always consult your dermatologist first before trying any remedy at home. Okay? Now, I've been asked questions like, can melasma go away on its own? Of course, sometimes it can go away, especially if you just had a baby after pregnancy and if you've just stopped your hormonal treatments. But you will still need some amount of treatment for it to go away. Is it harmful? No, melasma is not harmful. It's just purely cosmetics, but it can affect your confidence. So you need to be aware of that. Do sunscreen make a difference? Yes. If you use your sunscreen, maybe SPF 50 or 30, it can prevent, because it's the number one prevention, actually, the number one protection for melasma. All right. Now, in closing, I would just say that I know melasma can feel frustrating sometimes. Those dark patches, they'll just be there. It seems like they're not going away, but they will go away with patience, right? With the right care, with patience, with protection, you can reclaim your glow, you can reclaim your beauty. All right. But most importantly, don't allow, those patches to define who you are, to define your beauty. You are a beautiful person with or without melasma. But there is treatment, so that's a good thing. Just always consult a dermatologist, follow your instructions to the letter, and ensure you protect yourself as well. Okay, stay away from the sun as much as possible. And if you have to be in the sun, wear your hats, wear your sunglasses, use your SPF 50 or minimum SPF 30. That would help prevent melasma. And also, if you're treating it, also remember all the stuff that the doctor tells you to do, and you should be fine. Okay, but I hope this has helped, and I'll be coming back next time with another topic. But in the meantime, please, if you found this useful, subscribe to the channel, share with somebody that might need it, and look forward to seeing you again on my next show. Okay, take care for now. Be bold, be kind, and remain empowered. Okay, bye for now.